Anterior cruciate ligament injury. The mechanism of injury is typically rapid deceleration or direction changes. Patients can be pivoting on lower extremity with their foot planted, and that can cause an ACL tear. Signs and symptoms are pain. It's often sudden onset and severe. Sometimes the patient will notice a popping sensation at the time of injury, and there's oftentimes significant swelling with effusion and hemarthrosis. The joint will be unstable. On physical exam, there will be anterior laxity of the tibia relative to the femur, and you can notice this on anterior drawer test or Lachman test. By the way, here's a picture of an ACL that has been torn. You can see it's broken there. On imaging, plain x-rays are usually normal, but a fracture or a tibial spine or anterolateral tibial plateau might suggest an ACL tear. The MRI will provide the definitive diagnosis. The treatment for ACL injury is RICE, rest, ice, compression, elevation measures, and then you might need surgery depending on the patient's age and activity level. For instance, if they're athletes, they might want to get it fixed.